My name's June Oliver, and I'm an advanced practice nurse in the pain management field, working with inpatients and outpatients with pain problems, acute and chronic. While there are many challenges, we also do have successes that depend on an integration of a number of different kind of therapies. Some of the challenges that I face would entail insurance coverage for both Medicare and Medicaid, particularly the Medicaid HMO coverages. For instance, we have patients that do need to go home from the hospital on some kind of extended release opioid as one part of therapy, and MS Contin seems to be the only extended release that is automatically covered, and it's not appropriate for all of our patients, particularly if they have kidney issues. And we struggle to get other medications covered, such as OxyContin. That may be more appropriate for the patient. Even what's called a fentanyl patch may or may not be covered by them. Also, complementary or supportive services, psychiatric, psychological services are a big issue in terms of insurance coverage and can be critical to either trying to wean a patient or limit the amount of opioids that are required in giving them the support that they need to deal with ongoing chronic pain. We do have a clinic nearby that is supported outside of government funding by Lutheran Social Services that is truly invaluable, because they will take uninsured, poorly insured, any kind of patient and give them access to mental health services, a psychiatric nurse prescriber, and without that we would have a dearth of available psychiatric psychological services. Also things in Chicago, Illinois, where I am practicing, that are a problem. Access to things like swimming for people who've had multiple back surgeries. We call it post-laminectomy pain syndrome. Swimming can be very valuable in helping to control chronic pain. Many people cannot afford to join the Y, and or the Y doesn't have an access, a handicap kind of access to get them into the pool. Some of the higher end health clubs may have that, but they can't afford to join. And so they have limited alternative ways to control their pain in addition to opioids. Massage therapy would also be valuable, but again, that's a money access. Insurance is usually not covering that. Other alternative therapies, something called spinal cord stimulator, which is a non-medication way to control chronic pain, is poorly covered by Medicaid. It is a valuable alternative to opioids for chronic pain, but if the insurance is not going to cover the cost, hospitals are not going to be able to do it. Another drug called Prialt, which is a non-opioid medication in an implanted pump for chronic pain, poorly covered by Medicaid and only partially covered by Medicare, limits that access to many patients who might be considered for that therapy that is non-opioid and effective.